We know to end malaria, we need to reach the unreached. And given the topic of this meeting, we need to specifically reach unreached pregnant women. 2 years ago, I was at a clinic in the rainforest of Liberia, caring for patients, when a woman from a remote community gave birth to a 7.5-pound baby boy. He was the biggest of all her children, thanks in part to preventive malaria treatment she received during her pregnancy. She received that treatment not only from her midwife in the clinic, but also from her community health worker in her home community. She lived in a community where you had to take a motorbike for about an hour and then hike through the forest for another hour to reach. Thanks to her team of a community health worker and her midwife, who was able to get the preventive malaria treatment she needed and to get the care she and her child needed. But we know for too many women, this is not the case. For too many women, making 3 or 4 visits to the antenatal clinic to receive their dose of sulfadoxine pyrimethamine, or SP, is impossible, either because of cost or time or distance. With only 1/3 of pregnant women receiving the recommended 3 doses of SP, we must explore how to optimize opportunities for eligible women to receive preventive malaria treatment during their pregnancy. I must thank Unit8 for leading the call for community delivery. It's smarter to bring care to people than waiting for people to come to care. It's smarter to bring care to pregnant women than waiting for pregnant women to come to care. One of the most powerful tools at our disposal are community-based providers. That includes community health workers who team up with outreach nurses and midwives who visit homes. Through PMI-supported studies, we've seen that community health workers are able to improve coverage by working with facility-based health workers to deliver preventive treatment at the community level. Engaging community health workers as part of teams with midwives and nurses, just like was done in Liberia, leads to a 20% increase in the proportion of women attending at least 4 antenatal visits. And more women living at least 5 kilometers or further from a health facility also received at least 3 doses of preventive treatment. So, using trained, equipped, and paid community health workers, the science is clear, has a positive effect on reaching vulnerable rural women. Of course, as we explore the opportunities around task shifting to community health workers, I'd be remiss if I did not ask us to also commit to investing in those individuals, in their careers, and in their dignity. We must champion the rights of community health workers and other health workers to safe conditions. Over 115,000 health workers around the world, Dr. Tedros, the head of the WHO, said at the World Health Assembly this year, over 115,000 unprotected health workers have died from COVID-19. We should feel ashamed about that. That was preventable. It is unacceptable. Lacking masks and vaccines, midwives and community health workers have tried to continue their life-saving work. If we rely on these workers, we must respect them. We must protect them. Also, we must pay them fairly. Most community health workers are poor. Most community health workers are not paid. Many midwives and nurses we depend on also remain underpaid. I was shocked to learn that women on the front lines subsidize healthcare globally to the tune of over $1 trillion with their unpaid and underpaid labor. $1 trillion. That's a figure larger than the economies of over 150 countries. We must demand our finance ministers, our heads of state, abolish this pay gap and the structures that promote them. We should ask them, as we should ask ourselves, if we are paid for our work, why aren't health workers paid fairly for theirs? Together, we can find and sustain innovative, scalable solutions to reach more pregnant women. I'm convinced of that. Women who are threatened by malaria, a disease we know we can prevent, a disease we know we can interrupt so that a child has a safe birth. No mother or no child has to be left behind, And no community health worker has to be overlooked. No midwife has to be overlooked if we are all willing to go as far as it takes. Thank you.